Hey guys, what's going on? It is Dr. Kramer. I'm in my garage here. Bear with me today, trying to shoot you all a little video. There's been a lot of issues going on with knee issues in the practice. And so we have a lot of people asking questions about hips, knees, and what they can do about them. We've had some people dealing with some ankles. And so today I want to go through a really quick series of what I do to take care of my own lower extremities to ensure that we're taking care of or maintaining them very well. First thing is, I use a foam roller. This is what a foam roller looks like. I like the ones that have the hard plastic center in them because it actually allows you to get into the place where you're at. Otherwise, oftentimes they have a tube and it just doesn't really help you get in deep enough. And so what we're going to be focusing on today is a series of a couple of muscle groupings that actually have an impact on the way your hips, your knees, and your ankles move, right? We're not doing head, shoulders, knees, and toes. So first thing we're going to focus on here is that we have muscles that run from hips to knees. It's called our IT band and our adductors. They run on the inside of our leg. And so what I like to do is I like to start with a basic movement using our foam roller to evaluate what's happening here. So let me pull this screen down just a tad for you guys so you can see what's happening. And so what we're going to focus on here is how we're going to deal with our IT band. And so what I often like to do is I like to start and you just stick your leg straight out underneath it. And you start working down your IT band until you find a tender area. Once you find a tender area, your goal is to lay on it for 30 seconds. And so what I'll do is I'll come down a little further and I will just sit and hang out here for 30 seconds till I find it. And my job is to work all the way up and down the chain. And so by the chain, I mean from the knee to the top of your hip. You're gonna work all the way up and down that IT band until you find areas of tenderness. And each area of tenderness you're gonna hold on to for 30 seconds. The next group that we talked about on this one was your adductors. Adductors run from the inside of your groin all the way down to your knee. And so you're gonna have a vertical orientation on this. And what we're gonna do is we're gonna do the same thing, except for this time you're gonna frog leg. You're gonna place your leg on the side of the foam roller, and your goal is gonna be to find tender areas. And oftentimes, if you have a lot of knee issues, the most tender area is gonna be right towards the top of your knee joint. And you're gonna sit here and just let this rest for 30 seconds. And you're gonna work your way up and down this chain until you can get better. And those are the two muscles that I wanna focus on with regards to your hips and your knees. The next ones we're gonna look at is what's going on with your lower extremity. This is gonna go below your knees, this is gonna go down to your ankles. So that grouping of muscles is gonna be your pronators, and they're gonna be this muscle chain that runs right down here, and then your calf back here, which is a series of two muscles. And so what we work on as we come out and you do the same thing with the IT band, but we start on the lateral edge of our leg, right? And so what we're gonna do is we're gonna roll up and down this nice area on the front of your shin, and you're gonna find tender spots. Same thing here, we're looking for 30 seconds apiece, right side and left side, making sure that we get a nice healthy joint taken care of there. Calf is no different. You're just gonna roll right over on top. You're gonna hold yourself up, find a tender area, and hang out. That's what we're gonna do with our leg muscles. The last muscle we're gonna try to navigate through here is gonna be your external rotator of your hip. This is called your piriformis. And so this one runs from basically the back of your butt to the side of your hip, and it's responsible for allowing your legs to go like this. A lot of you are familiar with this because your sciatic nerve runs right through this area. And so it can be a definite cause of low back pain and something that can mimic low back pain. And what I like to do with this is you're gonna make a figure four, just like this, and you're gonna sit on that foam roller until you find the area on the piriformis that's most tender, and you're gonna hang out for about 30 seconds. Very, very simple. And that's what we do. And so, in conclusion, when I work through this with you guys, here's my thought processes. We want to take it a little bit at a time. You want to work on it on a daily basis. Probably about 15 minutes of work is what you're going to put in here. And so what I'm going to have you do is, let's start with the calf. So we're going to work on the side of the calf, then we're going to go to the back of the calf, then we're going to go to our IT band, and then we're going to do our adductors, which are the inside of our groin. And then we're gonna do our piriformis on your right and left side. And I want you to try to do that every day. and spend about 5 minutes on each segment. So about 2.5 minutes right and left leg. On the calf, 2.5 minutes right and left leg on your IT band and adductors. And then about 2.5 minutes on your piriformis. And do that for a month. You do it every single day. And then what we'll do is at the end of the 30 days is we reassess. We make sure that we're actually seeing change in your range of motion, your pain, and your functionality of the movement pattern that you have. This is one of the greatest tools that I've been given to help me navigate my own deficiencies within my own workout routines. I hope this helps. If you guys have any questions, post them below. We'll be here to guide you on this journey. God bless.